Welcome to another episode of MedMadness, where we dive deep into essential topics that every medical student and professional should master. In today's episode, we'll be discussing specific phobia, a common yet often misunderstood anxiety disorder. Specific phobia is characterized by an intense, irrational fear of a specific object or situation that leads to avoidance behavior and significant distress. Whether it's a fear of flying, heights, animals, or injections, specific phobia can severely impact a person's daily life. Next, let's discuss what specific phobia really is. This anxiety disorder is defined by a marked fear or anxiety about a specific object or situation known as the phobic stimulus. What differentiates this from normal fear is the intensity and persistence. It must last for more than 6 months. Specific phobias are surprisingly common, affecting about 10% of the population. These phobias often develop during childhood, frequently triggered by a traumatic event. For example, a child who is bitten by a dog may develop a lifelong fear of dogs. The fear associated with specific phobia can trigger intense anxiety, and individuals will often go to great lengths to avoid the phobic stimulus. For instance, someone with a fear of flying might refuse to travel by air, even if it means missing out on important events or opportunities. Now, let's consider a real-life case study. Imagine a young boy with an intense fear of thunderstorms. Whenever there's a storm, he refuses to leave the house and even asks to be taken home from school at the first sign of dark clouds. While it's normal for children to have fears, this boy's level of anxiety is so high that it's interfering with his daily life. This is a clear example of specific phobia. In this case, the first-line treatment for specific phobia is cognitive behavioral therapy, or CBT, with exposure therapy. The child might start by reading a book about thunderstorms. Gradually, he would be exposed to more anxiety-provoking situations, such as listening to the sounds of storms or watching videos, until the fear diminishes. Pharmacological treatment, such as short-acting benzodiazepines, is generally not recommended as a first-line approach, but may be considered in situations where therapy is not immediately available or when the phobic stimulus is encountered infrequently. To summarize, specific phobia is a common anxiety disorder characterized by an intense and persistent fear of specific objects or situations. The hallmark of this condition is avoidance behavior, which can significantly impair a person's life. The most effective treatment is exposure-based cognitive behavioral therapy, which helps individuals gradually confront and reduce their fear. Thank you for tuning in to this episode of MedMadness. Don't forget to check out the pre- and post-podcast quizzes to reinforce what you've learned today. And for those looking to solidify their knowledge further, our Anki flashcards are an excellent tool for ongoing review. Until next time, keep learning and stay curious.